If you're searching for the truth, real information, stuff that you can bank on, stuff that you can trust about the COVID-19 virus and the vaccine, you've come to the right place. And today's show is for you. On today's Idea Collective Live, we are interviewing Dr. John Raymond, the CEO of the Medical College of Wisconsin, and we are so excited. We're going to ask him about the current status of the virus in our community. What's going on with the vaccine? When can we get it? And when maybe we can get back to normal. Welcome to the Idea Collective Live. This is the official weekly meeting of your small business community. I'm your host, Pat Miller, the Idea Coach. So we're broadcasting on a bunch of different platforms all at once, and we want to make sure that we stay in touch with you as we continue to create content. That means check out our YouTube page and hit subscribe on the YouTube page, because that's the best place to find all of our information. And as we look forward into 2021, we are going to double down on more shows, more interviews, more classes, more content, all on the YouTube page. No matter where you're watching the show, though, make sure you're active in the chat, because while we're doing the interview, we'll be including folks from the chat as well. So if you have questions for Dr. Raymond, like, can you imagine that? We get to ask Dr. Raymond questions. Are you serious? Get in the chat, and we'll include as many of them as we can. Lastly, let's remember the power of the share button. Right now, if you click the share button, you can get out and share this message with people. So if you're thinking, man, people in my Facebook feed don't have credible information, now they do. Click share right now and send this broadcast out to your fans and followers. Today's show is sponsored by Bank 59, Serendipity Labs, and of course the Idea Collective for small business owners. And a big shout out to our BFF and the producer, JB, the showrunner. Thank you so much, JB, for your time. But let's get down to it. Let's welcome in Dr. John Raymond, the CEO of the Medical College of Wisconsin. Dr. Raymond, good afternoon. Welcome to the show. How's your Monday so far?
Thanks, Pat. Good afternoon. It's an honor to be here, so it's a great Monday. Thank you.
It's great to have you. And like I said in the open, it's really exciting to get some factual information, because it's been tough to just follow along and find stuff. And before we get into the questions, I just want to thank you for being a credible point of information for our community, because there's so much going on and so much changing with the virus and the vaccine. Let's start with the factual baseline. Where are we right now with the virus in our community?
Well, I'll start off by saying we're doing better than we expected to do after Thanksgiving. In Wisconsin, we've not seen a post-Thanksgiving surge. But before that, we had really two very rough months in October and November. There was about a 5-week stretch where we had the highest case burden in the country, and our trajectory was going in the wrong direction. And we came very close to exceeding the capacity of our healthcare systems to give good care to everybody. At one point, 95% of our intensive care unit beds were full. And our hospitals, I think, peaked at about 93.5% of all beds being full. You know, obviously not all those were COVID patients, but about a third were. And our hospitals are really set up to run at about 70 to 75% occupancy. So when you get over that, it's a stress. Now, what's happened after Thanksgiving? Our daily case counts are going down, but they're still much higher than they were this summer. The deaths are going up, but they look like they're peaking at a 7-day daily average of about 50 per day in Wisconsin. And here in Milwaukee and in southeastern Wisconsin, we're actually running just about a week or 2 weeks behind the rest of the state. I think the reason for that is that we were the beginning of the pandemic in Wisconsin. Here in southeastern Wisconsin, we got it under control, at least the first surge. It spread silently and slowly throughout the rest of the state. And then when the rest of the state began to surge, I would say that it boomeranged back here to Milwaukee.
Can you touch on treating the virus for a second? How are we doing now on treating the virus as far as preventing deaths or terrible outcomes compared to the things that maybe we've learned from the beginning until now? Are we better at treating it when someone is a severe case?
Yeah, thanks, Pat. We're much better than we were in March and April, but not as good as we need to be. And I think that's fair to say. We only have modestly effective therapeutics. And I know people have heard about the monoclonal antibody treatments from Regeneron and Lilly that are being given. They're helpful if they can be given before people become very sick. And dexamethasone, an inexpensive steroid, is reasonable when people are starting to look like they're going to go downhill pretty quickly. but we really don't have many other effective therapeutics. Remdesivir, it's modestly effective. I think what's changed is we've learned a lot about how to keep people from getting critically ill with COVID-19 with good supportive care. And one of the things that people learned early on in Italy and in New York is that rather than intubating patients or putting them on a ventilator early, everything you can do to keep COVID-19 patients off of a ventilator helps to save their lives. So lying them on their stomach and helping to breathe with a mask rather than intubation, I think it's saved a lot of lives.
So right now, let's touch one more second on the curve or infection rate. It looks like things are declining. Are we anticipating any sort of surge over the holidays, or do you think that this is a steady decline that we might be in?
It's obviously risky to predict the future. I think the answer to that depends on our personal behavior. If people let their guard down, we will have another surge. This was the third surge, and at most, 20 to 25% of people have been infected. So we still have a large reservoir of susceptible people. So it's really important to remember that even though our case counts are declining, we're still all in jeopardy. And with the 2 vaccines that are coming on the market, I would say that we do have light at the end of the tunnel. It might be a long tunnel, but that should give us hope that if we continue to practice good precautions, that we might be able to get on the other side of this alive and well and to resume some semblance of normal life.
Welcome to the Idea Collective Live. We're interviewing Dr. John Raymond, CEO of the Medical College of Wisconsin. And if you have questions for Dr. Raymond, put it in the chat and we'll include it here in just a minute. Now, you mentioned the 2 vaccines, which is terribly exciting. They've been approved and so many people are eager about when they get their turn to get it. So what can you tell us about how it's going to be deployed in Milwaukee and in Wisconsin so we can kind of estimate when we might be able to get it?
Yeah, thanks, Pat. Let me first start by saying that the 2 vaccines are nothing short of spectacular. Their effectiveness at blocking infection is close to 95%, at least measured a week after the second dose. These are 2-dose vaccines. We were hoping for 50 to 60%. So these are much, much more effective than the vaccines we give out for seasonal flu, for example. And they're game changers. They also appear to be quite safe with a few caveats. And so really, we all should not have hesitation to get these vaccines. They're going to be a game changer for us. There are other vaccines that may be on the market after the Pfizer and Moderna vaccines are starting to be distributed, which really can give us hope that maybe by this summer, we'll all have the opportunity to be vaccinated. We can have herd immunity and start to resume a new normal that looks a lot like the old normal.
New normal. Man, doesn't that sound great just to get back to the new normal? We have some questions that are coming in about the vaccine. And I guess from your point of view, you have most likely the best information in town compared to folks on our end of the monitor here. So one of the questions that came in is, what are you hearing about early reports of the shelf life of the vaccine? And once you're vaccinated, is this something that you're hearing will have to be an annual process or once forever? I mean, I know that this is speculation perhaps, but what have you heard? Because it's a common question.
Yeah, it's a great question, and no one actually knows the answer. So it will be speculation. I think what we're all expecting is that COVID-19 is going to be with us going into the future in some level. And it may be that we're going to need to have an annual booster shot, especially if the spike protein of the virus, which they use to attach and invade human cells, starts to mutate. The vaccines at some point in the future, not now, could be less effective. And like the seasonal flu vaccine, we may need to have an annual vaccines that's tailored to the COVID-19 mutations that we're seeing. But probably a booster once a year would be my best guess. I don't think we're going to need it any more often than that. These vaccines, the Pfizer and the Moderna vaccine, give an extraordinarily strong immune response, and we're expecting that should be good for 6 months to a year.
Now, as a professional, when you read the 90+% success rate, how did you react? Because as a layman, I thought, wow, that seems really high. What was your reaction?
Really, I almost wept tears of joy. It was so unexpected that we would have something, especially with a relatively new technology, that would be so safe and so effective. And honestly, we've all been suffering now for 10 months, especially small businesses. And to see that there may be a light at the end of the tunnel is, really, as I said earlier, nothing short of spectacular.
I want to ask about Milwaukee's deployment because they've issued the levels to which level you have to be in order to get the vaccine. But before we go there, I want to go back to something you said earlier about people shouldn't hesitate. And that seems to be one of the messages that if folks that are eager to get the vaccine and make sure that people get vaccinated, that we need to send. Do you think this is going to be a hard sell to get people to take the vaccine? What are you anticipating and what is your organization hearing?
Well, I do think that the tide is turning in terms of public sentiment about getting the vaccines because they appear to be so good and so safe. But I do think that it's going to be an area where we have to focus a lot of work, time, and energy on giving people good information and reassuring them that these are safe vaccines. And I think in particular, people in communities of color that may not trust the medical establishment, who actually are at higher risk for having severe COVID-19 effects, are going to need some special attention from all of us to make sure that trusted voices and trusted faces carry the message into those communities. The anti-vaccine lobby or group of people, we're never going to change their minds. We need to focus on people that are concerned that we moved this vaccine to market, these vaccines, in 10 months when the normal time period is 12 years. So again, that's probably the biggest problem for us. Vaccines don't do any good for us unless people take them.
Well, and sharing expert information like this today is helping to combat that ignorance or the things that they heard from their aunt on Facebook. So thank you for coming on today. We appreciate it. Let me ask about Milwaukee's plan. Are you familiar with the plan that I'm referencing of here's group 1A, here's group 1B, and how they've chosen to roll out the vaccine? Is that standard nationwide or is that a Milwaukee County decision?
Well, it is standard nationwide, but
Okay.
each community has the opportunity to make some choices because we don't have enough vaccines to cover everyone in category 1A. So the Food and Drug Administration, with concurrence of the Centers for Disease Control and Infection, released guidance that groups 1A would include frontline healthcare providers and nursing home residents and workers. So there are 21 million people in the US that fall in those categories. And we won't have 21 million doses of vaccine available probably until mid-January, maybe a little later than that. So for now, states, municipalities, and institutions are going to have to prioritize who gets the vaccine first out of those subcategories. And so, for example, at the Medical College of Wisconsin, we staff Children's Hospital, Froedtert, and the Zablocki VA. And we're working with the leadership of the medical staffs in the hospitals to prioritize who would get the vaccines first. We're expecting at MCW that we'll get our first batch of vaccines either today or tomorrow. Froedtert received those, I believe, theirs Friday, and Children's received theirs in the middle of last week and have started to administer those to faculty and staff. At MCW, we're going to prioritize our emergency department first, then people that provide frontline health care to folks where we can't do testing, like trauma surgeons, then our COVID-19 intensive care units and regular floor beds, and then people that take care of immunocompromised patients, like cancer patients, for example, or transplant patients. And we're also going to be careful, the vaccines, even though I said they're safe, they do cause fever, headache, fatigue, muscle aches, joint aches, and some nausea for the first day or two. So we don't want to give the same shift in the emergency department the vaccines at the same time, or everybody will be calling in sick at the same time. So we're also initiating a staggered administration of the vaccines. I would imagine that every healthcare system is going through the same internal process now, but we hope that by the time January rolls around, we'll really be thinking about what do we do with Group 1B. And that guidance was just released Sunday about Group 1B. And that's a group of 49 million Americans that are essential workers who take care of people face to face in the course of their job. So those would be some people in manufacturing, such as in food processing plants, people that teach, do public transportation, our police officers and people that work in prisons, for example, would be considered to be in that batch, and people over 65 would be in 1B. So that's 49 million people. So again, we're probably not talking about full immunization of that group, maybe until February or March. And then we can start talking about immunizing communities at risk and people that have pre-existing conditions, and then the general population.
So it's tough to see that far into the future, but this is early spring, late winter until folks that are not in one of these protected classes, if you will, of these certain job roles or certain immunocompromised groups. Before, there's a drive-through, get the vaccine at Miller Park or something like that. Might be until, and we're not predicting, of course, but by that timeline you laid out, it looks like it's into early spring before that seems to be available for the general public. Am I hearing you right?
You are, and obviously everything needs to go perfectly. This is probably the most optimistic case scenario, and it's one that Dr. Anthony Fauci has advocated for. He's become more and more optimistic. On the other hand, potential Surgeon General Vivek Murthy, who used to be Surgeon General, is being nominated for the Biden cabinet, said, well, everything needs to go perfectly. It could be all the way into 2022 before people all get vaccinated. But I would lean toward the more optimistic end. There are other vaccine manufacturers that are pretty far along in the process of testing their vaccines. Some reasonably good preliminary data, for example, for the Oxford AstraZeneca vaccine, 62 to 90% effective. It uses a much more standard technology with manufacturing capability that's already there. So once they get approval, they can ramp up the production and distribution very quickly. And unlike these Moderna and Pfizer vaccines, which require ultra cold chain distribution, these require just regular refrigerators, and their shelf life is much more stable and longer. So if we can get one of those vaccines on the market, like the Johnson & Johnson or the AstraZeneca vaccines, or Novavax, which is an American company, we could be looking more toward this spring rather than late in the year 2022.
Wow, what a dream scenario. We're talking with Dr. John Raymond, CEO of the Medical College of Wisconsin. I have a few more questions I want to ask, and I want to be respectful of your time because I'm so grateful that you're here. But we do have a couple of questions from the audience, if we can get through them real quick. Lisa wants to know, have they tested the vaccine on patients with autoimmune diseases like MS or other diseases like that? Can you comment on that?
Yeah, thank you, Lisa. The short answer is no. They didn't necessarily exclude people with autoimmune diseases, but like pregnant women who were not specifically excluded, there are so few people that it's hard to really say. Especially MS would be one where I would consult with my neurologist before I got the vaccines.
That's great to hear. Thank you for answering that. Roger has a question. Have you heard about the current mutation in the UK, and how does that affect vaccines that are being released at the moment?
Yeah, thank you for asking. Really important question. So there is a new predominant strain of COVID-19 that was first detected in southern UK about 2 weeks ago, and it's now the dominant strain. The mutation is in the spike protein, and people believe that it may make the virus more infectious or more contagious, not necessarily more lethal, but it again highlights the need for us to continue to protect ourselves with the 3 W's: watch your distance, wash your hands, wear a mask, and also limit the number of people that you interact with. I do want to say that early in the pandemic, there was a spike protein mutation that became the predominant strain in the US. It was called D614G. And there also is a spike protein mutation in South Africa. These may modestly increase the contagiousness, but probably not the lethality. And we don't believe that those mutations are significant enough that they will make the vaccines ineffective. So should have no problem taking the vaccines, even if these mutations become the dominant strain.
That's terrific information. Thank you for that. One more question from Sam, and I haven't heard this said out in the open. How much does the vaccine cost? Like if when it gets to be the time where the general public gets to receive it, how much is it going to be? Do you know?
Yeah, well, the Moderna and the Pfizer vaccines use a new technology and they're more fragile, so that logistics add some cost. I've heard estimates anywhere from $30 to $150 per dose. What's really nice about some of the vaccines using the more mature technology, like the AstraZeneca, Oxford, or the Johnson & Johnson vaccines, is that they can be produced and distributed for less than $10 a dose. Those are the estimates. Most insurance companies will cover the cost of the vaccine. The government is also sensitive about making sure that people that need it the most, like folks that are frontline essential workers that may live paycheck to paycheck and may not be able to afford the vaccine, will have that available to them. So really the cost shouldn't be a problem for the people getting the immunizations.
In just a few moments, we're going to open up the lines for some instant networking. So get ready to come on the air and tell us your story. But we have Dr. Raymond for just one more moment here. Two more quick questions, Dr. Raymond. Lynn wants to know, when do we expect to have more info on potential long-term effects of the vaccine? Will we just have to wait till we have a long-term timetable to measure, or what is the science showing us right now?
Yeah, thank you, Lynn. Well, normally when you roll out a vaccine, you have about 1 to 2 years worth of experience with hundreds of thousands of people that have taken the vaccine. We're really only have 2 to 3 months of experience with smaller numbers of people. In the Pfizer study, half of 43,000 patients got the vaccine, half got a placebo. And for the Moderna study, it was only 15,000 patients that got the vaccine. So we're really learning as we go. On the other hand, most of the side effects that you have with vaccines are pretty obvious within the first day or two. Sometimes it may take a month, especially for some of the rare side effects like Guillain-Barré or ascending paralysis. There will be some cautions. And the one thing that we learned early with the Pfizer vaccine was that people had severe allergic reactions that didn't show up during the phase 3 clinical trial. So 3 healthcare workers in the United Kingdom had severe allergic reactions. One was a rash and some shortness of breath. 2 others had anaphylaxis. And 3 healthcare workers in Alaska have had anaphylaxis. So what that means, earlier, Pat, you mentioned drive-through vaccinations. I'm not sure that's going to be feasible until we know a little bit more about these allergic reactions. They're actually pretty easily managed, but you need to stick around in the vaccination site for 15 minutes so that if you start to get a rash or shortness of breath, that somebody can give you epinephrine, histamine 2 blocker, Benadryl, the anaphylaxis under control.
So I just got to squeeze in 2 more. So when we talk about back to normal, I like to use imagery for back to normal. So when we're talking the Brewers baseball season, something we can all relate to, you and your team, I'm sure, would have be asked, should we have fans in the stands? Do you think we'll have fans at AmFam or Miller Park or whatever they're calling it nowadays?
Well, I think when 70% of the population has been vaccinated, it's very likely that we will be able to start to resume those types of activities. But looking into the future, I would say that it may be possible that we'll be asked to wear masks longer than that until we really know that we have the burden of disease in the community under control, and so that we can rely on contact tracing and the usual public health techniques to track down new cases. Because again, I believe COVID-19 is going to circulate in our population for many years to come, and that we're going to need to practice surveillance. So I do think that remote work, when possible, is going to be something that's going to be part of our future, not necessarily the only way that we work. And we may have face-to-face meetings, but I'm personally not going to be doing handshakes and hugs for a while.
What do you want to tell us about your staff and the team that's been leading the care for so many people? Do you have a message you'd like to send on their behalf? Because just know that we are grateful. What would you like to tell us about their efforts and what they've been able to do throughout all of this?
Yeah, just say thank you for being great clinicians, great scientists, wonderful public health experts, and a wonderful staff. We have over 6,000 people that work at Medical College of Wisconsin, and they've been great throughout the pandemic. Whatever we've asked people to do, they've done. Dozens, maybe even hundreds of our faculty and staff have worked in the community and tried to share good information. And what I would ask people, because people ask this all the time, Pat, you asked it earlier, what can you do to express appreciation for healthcare workers? I would say take care of yourself. It's wonderful to have people serenade us and cheer and send free food, but what we really need is for people to not get sick. And that really depends right now on people's personal precautions.
So I asked you before we went on air, you said you've done, did you say 300 appearances like this already this year? Is that how many you said you've done?
About 300 webinars and many radio shows as well.
Amazing. And you have one tonight. Can you talk about the community briefing this evening?
Yeah, thank you. Back along the theme of trying to deal with vaccine hesitancy, MCW from the very beginning of the pandemic has tried to engage people and communities of color, as well as the business community, to give good, culturally relevant, understandable information about the pandemic. And as part of that, we've had a number of community town halls. We had one last Friday to give people updates about the vaccines, and we're going to have another one at 6 o'clock tonight, and everybody's welcome to join. We had about 600 attendees last Friday. And right now, I'm actually trying to send emails to answer the questions that we were not able to answer live.
This has been incredible. Dr. John Raymond, CEO, Medical College of Wisconsin, thank you so much for coming on. And I can tell you, as someone that hosts shows like this, it's so hard to find credible expert information. And of course, you provided it with a smile. It was just great to have you, and hopefully we can have you back again sometime. Thank you for all you and your team do, and we hope to see you again soon.
Thanks, Pat. Honored to be here. Thank you.
Thank you. It's our pleasure. Dr. John Raymond, CEO, Medical College of Wisconsin. Well, how about that? You wanted some expert information? There we go. We got some expert information from Dr. Raymond. Thank you, Dr. Raymond. We really appreciate it. All right, so let's move on and take care of some business. Let's have some fun. So here's how we're doing the Idea Collective Live now is we do some instant networking. Instant networking is just like it sounds. Go to the link that JB's putting up on the screen, hit that button, and you'll be live on the show with us. And we're going to talk a little bit about you and your company, what you can do for us and what we can do for you. It's a way that everyone that's watching the show across all the different platforms can get to know you a little bit and maybe get you some business. So visit the link right there, and we will bring you on the show in just a second. One other thing that we're doing while we have some folks call in is we are doing an after party. So we get to do the show and get to talk to someone like Dr. Raymond, which is just amazing. And then we go over to Zoom for the after party. So that way we can get together, we can still do some further networking, we can kind of reflect on the things that we've learned about the broadcast today. If it's something like Dr. Raymond or something else, we can talk about that as well. So jump in to the after party, and we'll get that link up there as we continue. So we've got a few folks that have called in here to say hello and do some instant networking. And it looks like Eric Clark is the first one up. Mr. Clark, hello, sir.
No.
How are you?
I'm good. I was not prepared to be tossed in.
Well, you're tossed right into the fire, baby. You're live on air. Tell us who you are and what you do.
So my name is Eric Clark. I'm with Exponential Influence, and I help people maximize their content, repurpose it, and reach their core demographics.
Excellent. So what is your company doing? Who are you looking to work with?
Sorry, my phone was just ringing on my computer. So
that's all right.
Ideal clients, anybody that's looking to grow and increase their exposure, we help extract a lot of like the messaging someone might be saying in a conversation much like this, but then we repurpose it and chop it up and make it beautiful, titles, all that good stuff.
All right. So what do you have to offer people right now if they want to learn more? Do you have any free offers or downloads or something we can use to learn a little bit about X Influence?
I would say if you want to have a conversation with me, I'd be happy to do that. There's a Let's Talk button on our website, expoinfluence.com. I just like talking to people too and trying to see if I can help out, if nothing else, right? So if there's something that you could be doing or ought to be doing or might not even be aware that you should be doing, I can definitely help with just that to get things going.
Well, as we're looking into 2021, if we're creating content, are you repurposing the content and are you getting a lot of messages out of few? That's what Eric and his team will do for you. Eric, thanks for coming on, man. We appreciate it. So make sure you drop into the chat the Expo Influence contact information. That way everyone can know just a little bit about you. And Roger is with us, but without a camera. Roger, are you there?
Yeah, can you hear me?
Yeah. Oh, you sound great, but you look like a little white spinning circle.
I know. I don't know what the heck that's about. So I will figure that out by the next time. So I'm a professional speaker and trainer, and what I'm doing is helping people, leaders, create teams and companies that people don't want to leave. And so I do that with emotional intelligence. That's me.
Emotional intelligence. Yeah. So what do you have to offer people right now? Are you booking speaking gigs for next
Yeah,
year?
I'm booking speaking gigs, and I'm doing assessments. I'll do assessments for teams. We'll tell you, everyone is emotionally intelligent. Don't kid yourself. It's just, what areas do you want to work on in your self or your social awareness? That's where that comes from.
So let's help you. Who are you looking to connect with? You're looking for intros to what type of people?
Yeah, anyone, any places where you hear that they're having issues with retention, right? Employee retention, people who and leaders who are going through change, like all of them are going through change right now. But what is the best way somebody can start off Q1 strong? That's where you want me to help you out with facilitating that conversation.
Excellent. Roger Wolkoff, all about authenticity, man. Thanks for coming on. We appreciate it. So look up Roger. Make sure you drop your contact information in the chat, Roger, so we can take a look at you. Last call for the instant networking. This is your chance to get on in front of the audience and tell us about you and your business. And that way you'll get a chance to get some publicity, right? There's nothing wrong with that. Lisa Rabel, all about publicity. How are you, my friend?
I'm good. How are you? First time caller, long time listener. You know how that goes, right?
Exactly. So tell us about your business.
So Rebel Girl Marketing is a small business marketing agency, basically. We do everything to help small businesses as long as you need us. I call myself the Nanny McPhee of marketing. I'm only there as long as you need me, and then I'm gone. So whatever you need help with, as far as marketing is concerned, whether it's finding your brand or refinding your brand or figuring out who you are, that's how I can help your small business.
That's awesome. So who are the type of people that should be getting in touch with you right now?
So if you ever looked at your 2021 plan and said, oh, I have my financial goals and I have my revenue goals and I have my hiring goals, but I have no idea what I'm going to do for marketing yet, that's the ideal client for me.
All right. So who should we introduce to you? Like, is there anyone in particular that you're searching for? Like we should connect you with?
So we're not talking like, Thor, Captain America actors. That's not what you're talking about here.
No. Sure.
Okay.
Yeah, I've got his number. No problem.
Actual businesses. There's really no. I mean, I don't have any specific organizations that I'm targeting, quite honestly, because it's all based on need and mindset. So if they're ready to, they're ready to try the marketing, those are the clients I want. There's no like specific company or organization that I want to target, because it's not about, it's about the client being ready to work with me, not about the fact that I can help them with something.
All right.
That makes any sense whatsoever.
Yeah, sure. Rebel Girl Marketing. Thanks for coming on. We appreciate it. All right, so let's do this. We are going to bounce over to the after show networking. So if you've joined us on Twitch or LinkedIn or Facebook or Twitter or YouTube or wherever you might be, hit the link that's on the screen right now, because we're going to jump into a Zoom call and chat with each other. A few announcements before we wrap up today. We want to remind you that we're looking for redistribution partners. So if you're looking to get some great small business content in front of your clients, we'd love to welcome you as a partner of the broadcast, and we could broadcast this show right on your social media channel as well. So if you're thinking, geez, I wish I could do something like this, well, you can. You'd be a partner of the show. Let me know if you're interested. Also, we have a little bit of a break coming up. We're going to take some time off here at Idea Collective HQ. There's not going to be a show next Monday, so we're going to take next Monday off. It's going to be a little bit of rest, maybe a few cocktails, maybe a few more cocktails, maybe some naps. You know how it goes. So we are going to be coming back with you on Monday, January 4th is the first show of the new year. So we will be there. Thank you to Jennifer Buchholz, who's producing the call, the ultimate connector, my business BFF. I'd put her back on screen, but her equipment doesn't work. We've got to get that fixed, JB, so we can make you a rock star. Also, thank you so much to Dr. John Raymond, CEO of the Medical College of Wisconsin. It's so great to talk with him and get that accurate information. If you're watching on YouTube, before you close, click subscribe. That way you won't miss future episodes. I'm Pat Miller, the Idea Coach. Thanks so much for tuning in. We'll see you at the after party.